initially in the Dallas and Miami area before moving to Sarasota, Florida. She's board certified clinical specialist in oncology, physical therapy, and has been treating oncology patients for 7 years. But it seems to me like it's been a lot longer because she's so knowledgeable. She completed the ReVital cancer rehab certification through Select Medical in 2018, and she's currently on faculty for ReVital rehab, teaching and creating continuing ed courses for other clinicians. In addition to her oncology patients, she also treats other patient populations, including general orthopedics and TMD, which I had to look up as I know as TMJ. I can't say enough about Michelle's skills and approach to what we all deal with. And I wish everybody that had radiation had a Michelle. So thanks for being here, everyone. And Michelle, take it away.
Thank you so much for the introduction, Joan. I'm going to go ahead and share my screen. Bear with me for just a second as I get that set up. Here. Okay. Let's see. Can everyone see that? Perfect. Okay. So like Joan said, my name is Michelle, and I'm a physical therapist. I want to thank Erin and Joan again for having me on here, and I'm excited to talk with everyone about the late and lasting effects of radiation for survivors of Hodgkin lymphoma and how cancer rehab can help. Okay, so my goal by the end of this presentation is that all will understand the basics of the late effects of radiation, specifically radiation fibrosis and dropped head syndrome, understand who is on the cancer rehab team and how they can help manage late effects of radiation for survivors, and then learn general exercise guidelines and 4 specific exercises that can combat changes that can occur following treatment. So what are some impairments related to Hodgkin lymphoma and its treatment that cancer rehab can help manage? So you can see there's a bunch of stuff that it can help with. Fatigue, peripheral neuropathy, cognitive decline, pain, difficulties with activities of daily living, balance, falls, lymphedema, cardiovascular dysfunction, or speech or swallowing. Almost all of these impairments can be caused by radiation. So let's look a little deeper into how. I'm sure a lot of y'all know this information from your previous treatments, but I like reviewing some of it before we get into what the causes are and what cancer rehab can help more with. So this is just the general overview of the radiation fields that can be potentially used. You have the mantle field, which includes your heart and lungs, and many other important structures in your chest and neck areas, such as bones, muscles, nerves, and blood vessels. The inverted Y includes the abdominal and pelvic regions and all the organs, muscles, bones, nerves, and blood vessels in that area. And total nodal is a combination of the two. Different tissues in our body have different sensitivities to radiation. The lungs are the most sensitive, requiring the least amount of radiation to be damaged. That's why they often try to shield it. The nerves are more resilient, requiring a higher dose of radiation to cause problems. And this is why each person can have a different presentation, even if they had the same radiation treatment for their disease. So here are some of the official definitions regarding the changes that can occur after radiation. So radiation fibrosis describes the insidious pathologic fibrotic tissue sclerosis that often occurs in response to radiation exposure. And radiation fibrosis syndrome describes the myriad clinical manifestation of progressive fibrotic tissue sclerosis that can result from radiation treatment. So what does that really mean? Following radiation, the tissues in the radiation field, including skin, muscles, blood vessels, and nerves, lose their elasticity and become more restricted in their mobility in the process known as radiation fibrosis. And then radiation fibrosis syndrome is all the symptoms that you may feel as a result of these changes. So that can include pain, stiffness, skin changes, and difficulty swallowing. as well as any lung or heart problems that may develop later. These are usually unique to the individual due to the specifics of the radiation treatment and any other cancer-related treatments you might have had, including surgery or chemotherapy. And then your physical status and your health status in general can also contribute to the risk and severity of the radiation fibrosis symptoms you may experience. Radiation fibrosis is typically a late effect of treatment, taking months to years to develop and progress. However, some symptoms can develop weeks after treatment has been completed. So I want to touch briefly on some of the other late effects that radiation can cause that can affect function. So the neuromuscular system is a big one, and it can cause a variety of different types of neuropathic symptoms. Sexual dysfunction and cognitive impairment are less common, but are still a possibility. And then when we think of the musculoskeletal system, the more common issues, if you have mantle field radiation, is neck pain and shoulder dysfunction. With the inverted Y, you might see more hip dysfunction or back pain. Swallowing is typically less affected, but it is still a possible late effect. And then another common musculoskeletal issue from mantle field radiation or total nodal radiation is dropped head syndrome, which we'll discuss in a little more detail. There also can be effects to other body systems, including cardiovascular dysfunction, pulmonary fibrosis, gastrointestinal complaints, and lymphedema. The most commonly reported late effects following radiation include pain, fatigue, and shortness of breath. And then I'm going to kind of go through some of these pictures and what they are demonstrating there. So the picture on the left, where it says B, shows how the pectoralis muscle or your chest muscles are usually spared due to shielding of the lungs, which can lead you to have a kind of a more rounded shoulder posture. The middle picture shows some muscle atrophy of the neck muscles, the upper back muscles, and the rotator cuff muscles, which can potentially lead to dropped head syndrome. And then the picture on the right shows cervical dystonia or muscle spasms in the neck muscles on the front and side. So all three of these are possibilities of late effects of mantle radiation. So now we're going to talk a little bit more about dropped head syndrome. So it's characterized by severe weakness of your neck extensor muscles, or the muscles on the back side of your neck, which include your neck, your mid-back, and your shoulder muscles, which ultimately cause an inability to extend your neck, resulting in significant forward flexion of your head. So in order to spare the spinal cord, many patients have a posterior neck boost, leading to a potential hot spot or an area of increased radiation on those neck extensor muscles. So any survivors who do have dropped head syndrome would benefit from a referral to a speech language pathologist due to the potential for swallowing issues or aspiration pneumonia based on the forward position of your head. It can also you can also develop pulmonary or breathing issues depending on the severity of the position. This picture on the slide here is obviously a more severe depiction of it, but it can present in a little bit more of a mild presentation, like this middle picture on this slide here. So what are some of the options to help manage some of these late and lasting effects that we talked about? So one option is cancer rehabilitation, which is a supportive healthcare service involving coordinated multidisciplinary interventions delivered by trained professionals. So these efforts are targeted to improve your function and participation in life roles, work, and leisure activities. Cancer rehab is appropriate for individuals in all stages of their cancer treatment, including pre-treatment, or what we consider to be prehab. So it would aim at providing education or strengthening prior to starting chemotherapy, radiation, or surgery. Cancer rehab can happen during active treatment. So this would be provided with your treatments that you're going through, or post-treatment. So this would aim to minimize any side effects, short-term or even long-term or delayed effects at any point in time after completing treatment. So who's on the cancer rehab team? So there are many different specialists who can contribute, but we'll focus on occupational therapists, speech language pathologists, and physical therapists. So some can work in even more of a specific domain, such as cognitive rehab or lymphedema therapy. And which team member any particular survivor might see is dependent on their particular functional needs. We all work through the continuum of care, and it is common for a person affected by cancer to benefit from more than one discipline. So together we aim to improve the quality of life through higher levels of function, participation in life roles, and reduce the risk of late adverse effects. So why should you see a cancer rehab specialist versus the closest therapist to you? So first is our knowledge base. So prior to starting any therapy, a thorough history and understanding of the person's cancer diagnosis and treatment are important. So the cancer rehab therapist will integrate this knowledge of the medical management of cancer into the treatment plan and determine how the cancer treatments can affect an individual's function. We understand these aspects better compared to general therapists. Second is our care approach. So oncology rehab uses a whole systems approach versus a regional approach often taken by other types of physical therapists. And this is because of what we talked about earlier with the systemic treatments that people can undergo for their cancer. And as I mentioned before, those side effects can affect many different body systems that can in turn affect a person's ability to function and perform day-to-day activities. So a cancer rehab therapist looks at many body systems that may be affected by cancer treatment when evaluating and treating these individuals. So now let's talk a little bit more about a few of the different disciplines and what each one kind of specializes in. So occupational therapists typically focus on functional limitations to help you improve in your ability to perform daily activities at home and or at work, offering adaptive strategies and equipment if necessary. They can also help you with more fine motor skills, including writing, grasping, and pinching. And some occupational therapists specialize in cognitive rehab. Speech language pathologists focus on improving speech, swallowing, and cognitive deficits. And physical therapists also work on improving function like occupational therapists do. We can address things like walking, balance, and transitional movements, in addition to more specific body parts such as your neck or your shoulder. And then lymphedema therapists are typically occupational therapists or physical therapists who receive additional training in management of lymphedema through the use of manual lymph drainage, compression, and exercise. Any survivor with surgical removal of lymph nodes or radiation to lymph nodes is at risk for developing lymphedema and could benefit from this specialty. So these next few slides are specific to the United States, as that is where I practice. Other countries have cancer rehabilitation services. They just may be delivered in a slightly different manner. So for the US, does medical insurance cover cancer rehab? And the answer is yes. So clinics work with your insurance and bill the same codes that we would for any type of diagnosis. And then how can you find a cancer rehab specialist? So ReVital is located in 24 markets throughout 21 states. We really strive to deliver outcomes that matter to our clients that come in throughout their cancer journey by understanding their needs and goals and providing specialized comprehensive services. So through our mission, we establish comprehensive cancer rehab as a standard of care for people affected by cancer. So that's our ultimate goal. I recognize that we may not be located in your community. So an additional way to find cancer rehab in the United States is through the American Physical Therapy Association's Academy of Oncologic Physical Therapy. You can search for providers throughout the country on the website. Other countries probably have similar resources to search for providers near you. And then the World Physiotherapy Organization has a subgroup specific to the oncology population referred to as the IPT HOPE. And that they can provide additional resources regarding cancer rehabilitation in different countries across the world. So earlier I talked about how cancer rehab can be used at any point in the cancer continuum. Exercise in general can be applied the same way. So there's different benefits of exercise depending on the time frame. So exercise before treatment or prehab can optimize function and condition, improve treatment tolerance, and reduce the impact of adverse effects. Exercise during active treatment can assist with treatment tolerance, including like staying on chemotherapy or staying on your radiation regimen. Maintain performance of activities of daily living and functional tasks. Decrease cancer-related fatigue and cancer-related pain. Decrease anxiety and depression, and improve sleep. And then exercise and survivorship, which is where I'm going to focus on a little bit more, can promote active recovery and a healthy lifestyle, can prevent further impact from late and long-term effects, improve bone health, improve body composition and weight control, improve physical function, endurance, and strength, and decrease risk of recurrence for certain cancers. So I encourage anyone experiencing difficulties to reach out to a cancer rehab specialist. Nothing is too small to start working on that would improve your quality of life. So while seeing a cancer rehab specialist is important for specific complaints, there are some general exercise guidelines that you can follow on your own. So the American College of Sports Medicine and the Center for Disease Control have created guidelines on physical activity for overall health promotion and prevention. So for adults 16 to 64, it's defined as 150 minutes a week of moderate intensity aerobic activity, such as brisk walking, or 75 minutes a week of vigorous intensity aerobic activity, such as running. Aerobic activity should be paired with strength training 2 to 3 days a week, working all major muscle groups. And then exercise should begin and end with a warm-up and a cool down. For adults 65 and older, it's also recommended to include balance exercises in addition to the previous recommendations. So the biggest takeaway for people living with and beyond cancer is to avoid inactivity. Experts recommend trying to exercise at least 10 minutes at a time and spread the activity throughout the day and the week. And then in general, more exercise is better. So if you're already meeting the exercise guidelines without any difficulties, improving exercise up to 300 minutes a week is associated with additional benefits. The American College of Sports Medicine had a roundtable specific to exercise for cancer survivors and had a few additional recommendations, including just avoiding inactivity in general, returning to normal activities as soon as possible after surgery, or trying to continue your normal activities as able throughout your treatment and afterwards, exercising during and after cancer treatment, and then making appropriate modifications with metastatic disease or cardiac conditions. And then a few additional considerations for cancer survivors include what are your goals of exercise, if there's any contraindications to exercise, whether cancer related or non-cancer related, cancer specific reasons to stop activity, injury risk considerations, and general exercise recommendations. So if you're ever in any doubt about physical activity or exercise, it is always safer to reach out to a licensed professional with specialized cancer knowledge. So I'm actually going to have everyone try to turn their cameras back on for this next part, because while I can't give specific exercise information, I wanted to share 4 exercises that I will typically use to address posture and core stabilization. So if you have space where you're at, feel free to try some of them with me. Most of them can be done sitting down, so that should be pretty easy. Just a little caveat, if you have any pain with these activities, don't perform them, and follow up with a healthcare provider if you're interested in continuing with the activities. So the first one is often referred to as a chin tuck or a head retraction. So you can perform it laying down. That's usually the easiest position to learn how to use these muscles, but sometimes that's not very comfortable. So you can also do this one sitting or standing. So what you do is you gently pull your chin in without looking down, and then you hold for a few seconds and then relax. And then you usually do this one multiple times in a row. You should not be pulling your chin in with maximum effort. It should be a light effort. That's my first one. The second exercise I usually give is referred to as scapular retraction. So this exercise can be performed in any position. So laying on your back, laying on your stomach, sitting or standing. So what you're going to do here is you're going to bring your shoulder blades down and in, trying not to shrug your shoulders. And once again, you should not be performing this with maximum effort. And then as a reminder, don't perform this activity if you have any pain while you're doing it. So those are kind of my more upper body ones. And then a couple ones for the lower body that help with posture. This third one is referred to as standing hip abduction. So you want to have some support for your hand on a steady piece of furniture or a countertop. And then you're going to lift one leg out to the side, keeping your knees straight and your toes pointing forward. Your trunk and your pelvis should also be pointing forward. And then you can repeat on the other leg as appropriate. You do not need to move your leg out to the side as far as you can. The goal is to really stay in an upright posture. And then this exercise may not be appropriate for certain survivors who have bone metastases or other musculoskeletal conditions. So it's always better to ask or reach out with work with a licensed healthcare provider if you're unsure. And then once again, don't perform if you have any pain. And then this last exercise is diaphragmatic breathing, which can have many benefits, including lymphedema management, decreased anxiety, improved breathing mechanics, which can decrease neck pain. And then it can also increase your efficiency of your core muscles. So once again, you can perform this in any position. So on your back, sitting or standing. The goal here is you take a deep breath in through your nose, feeling your belly expand, keeping your chest and shoulders relaxed. And then you breathe out through your nose or mouth slowly. If you're doing it sitting, you can push lightly into a table with your hands, and sometimes that can help engage your core a little better. As a reminder, don't perform any of the activities if you have pain, and be sure to follow up with a healthcare provider if you're interested in doing more activity but are unsure of how to do it. Thank you everyone for your time today, and I'd like to go ahead and open up the floor for questions. I don't know if there's any in the chat already, Joan.
I don't see any yet, but thanks, Michelle.
Sure.
I have a question.
Okay.
Actually, I don't know if it's more for people watching. I never heard of a prehab for this. Has anybody heard anybody that's had prehab treatment before getting radiation?
Nope.
Is that a ReVital thing, or do you think that's starting to happen? Erin, have you heard of it?
Never. But I think it's great. I mean,
it would be great if it happened.
It's not as common. There are certain diagnoses that we definitely see more for prehab. So there's a lot of times we'll see breast cancer patients before surgery. There's a big push when I was in Dallas to see head and neck cancer patients before they had radiation treatment. And then the current one that's undergoing a lot of research is for lung cancer. For lung cancer patients to go through 4 weeks of therapy before having a lung surgery. So I think this idea has shown really good benefits in the research, but I don't think it's implemented in practice very well yet, unfortunately.
Yeah, maybe we could add that, Erin, to the list for the people coming up behind us.
yes. Their list is getting longer by the minute, unfortunately. I just threw a question in there, Michelle, from someone who had written me an email about exercise and how vigorous to get. I think this is actually a fairly common concern for people once we start feeling good and we start doing more. How do we know when it's time to shut it down because we're doing too much?
So doing more is great. So if you have that energy and you want to do more activity, like I said, increasing your aerobic activity more is beneficial. The big thing we really push for all cancer survivors is to progress very slowly. So usually you run into trouble if you try to increase that activity too quickly. But there is no reason why you can't keep progressing and keep increasing the weight you're lifting or increase the time you're walking. The big takeaway I usually give my patients is you shouldn't have any pain, right? You should be able to sleep well at night. So like if you don't sleep well that night, you might have done too much. And you shouldn't have any pain or issues the next day.
So just to go along with that, a lot of us have cardiac issues as well as, physical therapy needs. And so I guess my question would be, how do you coordinate with the cardio-oncologist or the person's physician about stressing the heart too much? I think a lot of us are walking that fine line.
Right. So that's where I usually try to do either if you're like not on a medication that blocks your heart rate. So like as long as you're not on like a beta blocker or anything that is purposely limiting your heart rate from getting too high. If you have like a smartwatch or anything like that, I usually give people a target heart rate range. And I am usually on the lower end of doing that, right? So like a lot of people who are just like younger adults that are completely healthy can work out at a pretty high segment of their heart rate reserve. I usually start everyone really low, right? And then see how they tolerate it and then can slowly do that. If you're on medications that limit your heart rate increasing, then that's not really a great way to manage that because you're not getting an accurate assessment of how hard your heart is working. So for those, I wonder if I might have a picture of it. For those, I use what's called an RPE scale or a rate of perceived exertion. And I want people between a 3 to 4. Let me see if I can find a sign for that.
Carolyn Penny has raised her hand too.
Okay.
Are you ready for me?
Yes.
So I went to a ReVital physical therapist. It was an 1.5-hour drive each way. She was fantastic, but sustaining that level of travel commitment was not workable for me. And I don't know that there are other therapists on the list that you suggested who will be nearby. Is there something in particular that I can look for when I try therapists who are closer? Do I need to look for people who have experience with fasciitis, or are there ways I can connect more readily with someone who's closer by?
Yeah, absolutely. So there's a couple different ways. If your ReVital therapist is comfortable, a lot of times I'll talk, because I see a lot of seasonal people right where I live. So a lot of times I'll communicate with a different therapist with what I felt like was helping and what wasn't. So if you feel like your ReVital therapist would be open to that, that's a good place to start if you find a therapist. And then the big thing I would ask is if they have any experience treating cancer patients in general, even if they're not certified. And then I would look and see if they treat more people with chronic conditions in general. So if you look for therapists that treat maybe people with chronic pain or people with like fibromyalgia or things like that, they'll typically have a better knowledge base of progressing more slowly than your general orthopedic therapist who treats mostly like ACL reconstructions and stuff that like really want to push people quickly, if that helps a little bit.
That does help. And so then I have a related question. My understanding had been, for those of us who have radiation fibrosis, that there is a limit as to how much the muscle can rebuild. So that I thought I heard you say earlier that we can continue to progress and progress. My understanding was that can actually do some damage if we are trying to do that beyond what our muscles can do.
That depends on what you're working on. So that was more of like an aerobic component, right? So as long as your cardiovascular system, even with cardiac conditions after radiation, still has the potential to improve and be managed. So if you progress that slowly, you can. And then regards to like general like weightlifting. So if you only had like mantle radiation, as long as you're doing them safely, there's no reason why you can't progress like lower body exercises consistently. For very targeted muscles that were in the radiation field, yes, there is a cap to the improvement that you can do. And it is somewhat limited. Sometimes increasing can set something off pain-wise or discomfort-wise. And so that progress is a lot slower. And that also depends on how far out from treatment you are.
Well,
Like-
I'm 4 or 5 years out past treatment.
Yeah. So then so then the changes are going to be much more smaller, and you're probably not going to be able to increase the weight for those particular muscles a ton.
Thank you.
Sure.
The other thing, just to jump in for a second, is that I found it's not linear. Which was really important to remember. Someone helped me remember that.
Yes, I had a similar experience, and that was a question I was going to ask, but it was partially answered. I'm almost 40 years out, but I had been doing until maybe 4 or 5 years ago, very extensive strength training. And I had mantle radiation and I guess peri-aortic, but mantle radiation. And when I went to Dr. Stubblefield, I went to physical therapy at Sloan Kettering and to Dr. Stubblefield at Sloan Kettering, and they said that you could, along the lines of what you're saying, you could actually do more harm than good. And when I saw that, and the reason it made sense to me is when I saw your picture of the man, you said that if they shield your lungs during radiation, the pectoral muscles are more preserved. And that's what they said. They said that the chest muscles are stronger. So all the upper body stuff was actually increasing the hunching. And they recommended stopping doing the strength training altogether, which I didn't do. I continued it, but I ultimately stopped it, and I tried to do some at home. But now I've just stopped it. And you know, again, you hear all the time strength training a couple times a week. So for people who have received mantle radiation, I'm assuming that means not upper body. I guess this is where my confusion comes in. Is there?
So there are still exercises you can do that are safe for those muscles. It's just much more nuanced than like big, like overhead presses and things like that, because you do still want to work those muscles with their tolerance, but that looks a lot less like going to the gym and lifting weights and doing 3 sets of 10, right? It looks a lot more on focusing more on posture type muscles and doing less repetitions and doing them more frequently throughout your day versus that what we typically think of for strength training.
Okay, because I guess what kind of concerns me a bit is the idea that you could be doing more harm than good.
My general rule is for every type of pushing exercise you do, you should be doing at least 2 pulling. Right. So you want to think every time you do something that's going to bring your shoulders forward, you should be doing at least twice as many things that are going to open it back up.
Thank you.
Michelle, you've got a couple of questions on here. I don't know if anyone else has their hand raised as well. Can you see the questions that are in the chat?
Yep. Okay, from Gloria. I'm a terrible sleeper and I exercise. Any tips?
Okay, so that one is tough because sleep is very complicated, and sleep is tough with radiation especially if you've had mantle radiation or any radiation to your neck, because finding a comfortable position can be difficult. I usually focus mostly on general sleep hygiene tips because that's not my super specialty, but like things like avoiding screens for at least 30 minutes before you go to bed, not eating too quickly before you go to bed. If you exercise consistently, you don't want to exercise too close to when you go to sleep either. And finding things that kind of relax your mind to help with that part of it. Those are kind of the more general things I can give you, Gloria, without knowing more about what's going on.
Okay, next question from Vivian. What type of neck, upper back supports or braces do you recommend for severe neck drop?
Okay, so there's a couple. The headmaster collar is the one that Dr. Stubblefield usually recommends. That one I think is a little more on the expensive side. I look for things that are going to give you a little bit of support here, right? Kind of hold your head up. But you also want to look for something that's going to bring your shoulders back. And a lot of those have stuff that come across the front, so you got to make sure that it's comfortable. I usually try to have people not wear them all the time either, right? So you do want to spend some time out of a brace. But for people who work on like a computer a lot or have a hard time like sitting up for long periods of time, it's good to wear them during those periods and then take them off later.
Great.
A question related to this real quick. I have not yet used something like that, and I probably should. But is there any? I guess I've always been thinking if I use a brace, it's going to make me weaker because I'm not developing muscles in my neck, and I guess I just don't understand how it works. That if you use a brace.
So there's the caveat with that part, right? So that's why I always tell people not to wear it all the time. If you wear it all of the time, that's going to be a problem, right? Like it's gonna weaken the muscles even more. But if you have a really, like, you're still working, you have a meeting that's 2 hours, or you're going out to dinner for something really special that night, and you know you always have neck pain at the end of the night, wear it during the day, and then it'll save some energy. So you want to think of it as an energy saver, not something to wear all the time. So wearing it for short periods in positions that are the most uncomfortable, that to allow you to do more things later without the brace on. So that's usually how I try to have people think about it when they start to get towards that position or towards that time.
It's not a corrective thing. It's more of a
supportive thing.
Okay. Thank you.
Sure.
Okay, next question's from Bruce. You might have answered this at the beginning. Is there a resource online for non-ReVital PT to become more familiar with therapy for us? Is that the APTA?
Yeah, so they can do things, clinicians can search for generalized continuing education. The APTA Oncology section puts out continuing education resources for clinicians throughout the country. And that's like in-person courses and online courses. The American Physical Therapy Association, the Oncology section has a journal. And so like referring people to the journal can give them additional research and information on it. And I know not just ReVital wise, there's a big push in the general APTA community is to try to get more information out there, because there are so many people living longer after having cancer that are having later side effects that need therapy. So there are some resources out there. We're trying to have a big push just in general in the therapy world to get more of this information out there. But that Oncology, I can find a link and put it in the chat.
Great.
The Oncology, American Physical Therapy Association of Oncology, the Oncology section is probably the best option to look for other resources for both clinicians and patients.
Great, thank you. Yeah, if you could add that, that would be great.
Yeah, let me see if I can find that.
Amanda wants to know, she said, Michelle, how does this impact those of us who've had a double mastectomy on top of their mantle radiation?
So that is going to bring your shoulders even more forward. So this is where really working on the strengthening what you can, or if you're in a position where you have to be like on a computer a ton, that might be a time to consider a brace part-time to really get you out of that kind of forward position. So it's going to just contribute to the keeping everything tighter in the front, just because typically that's what happens after that kind of surgery.
That shoulder blade retraction one at the beginning helps, I think, too. It's helped me, Amanda.
Joan, I think Heidi wanted to make a comment, and I know you have a couple more questions, but
Heidi, you want to jump in?
Oh, we have to
I think you're
unmute.
on mute still, Heidi.
Hi, Michelle.
Hi.
I would just like to have just put in a heartfelt thanks to Erin and our wonderful support group, because I wouldn't have found Michelle without our group. I was just scrolling through one day. I'm not on Facebook very often, but I saw Sarasota, the word Sarasota. I said, I'm going there for winter, just 2 months, but I really need a tune-up because of my radiation fibrosis. So I looked at it, and Joan, my new friend, put me in touch with Michelle. And long story short, I was with Michelle 2 months while I was vacationing, and I felt much better. It was just great to be in contact again, because I was at Dr. Stubblefield's New Jersey clinic for 2 weeks back in 2019. And I really felt that I needed a tune-up from a pro, someone who understood my condition. And lo and behold, I found Michelle, I found a new friend, Joan, and this group is just so wonderful. So really, I just wanted to say thank you to everybody.
Thank you. Heidi, thank you so much. And I saw Amanda waving her hand. I don't know if you're also a patient of Michelle. So maybe, I know we have more questions, but I wanted to ask Heidi and Amanda and Joan if they could just say, if you're willing, say a few words about what kind of work you're doing with Michelle, what areas that you're working on, and just love to know what it looks like for you.
Yeah, I don't mind. I've probably been working with Michelle for maybe a month and a half, almost 2 months now. And I got to the point where I couldn't really turn my head while I was driving. I just had severe pain in the neck. And then because I've also had breast cancer and the double mastectomy, I just work here at my computer all day. So we're just trying to open this up and correct posture and strengthen really a lot of the neck muscles and the shoulder and upper back. So we're working hard on that, and I'm trying to remember to do my PT every day. And I also found out about it through the Facebook group. So same as you, Heidi.
Which is great. Yeah, Michelle helped me with my neck muscles that are feeling very weak right now, because I said I needed a tune-up. And although I'm pretty good at doing my homework, the fact is it's just getting worse. And so after 2 months with Michelle, I'm inspired to do more homework and to keep it up. And I'll see her next winter.
Joan, how about you?
Yeah, I was thrilled to find Michelle, and I found her through the ReVital search locations. And I have the same issues Amanda has, and also Heidi, because I was treated over 50 years ago. And Michelle is keeping me honest to do my exercises and not overdo, but still push and try to find that delicate balance. But I think that at this point, we've all learned the importance of whatever the discipline is, to have a good clinician who listens and understands exactly what our specific issues are. And this just hits how important that is. So I think if you can take advantage of Michelle's skill set or recommendations, because something, Erin knows this, I didn't want to do this, but I feel like it's so important that we find and help each other. So that's my story. And I made a notebook. This has helped me a lot. I made a notebook with all the exercises, and I keep it where I can see it, and it reminds me to do it. So little cues, I think, to keep with it really help, because it's so easy to fall off an exercise program.
I'm just curious if there's anybody here who doesn't have neck issues. Anybody? No? Wow.
I don't have any neck issues at all.
You don't?
No.
Oh, love you. Did you have radiation up to your neck, or maybe?
Oh, I had a mantle field radiation 5 25, I guess, rounds of it to my, I guess, left center chest, and it was heavily shielded. So they tried to minimize it as much as possible. That was back in Staten Island University Hospital.
And how long ago was that, Fred?
Yeah,
1994,
my question.
95. Actually, my doctor, my radiation oncologist was Dr. Gil Liederman. He's had a little bit of notoriety. He treated George Harrison. I don't know if you heard about that story, but yeah, so that was my radiation oncologist. So
Chris,
I don't have
I
issues.
hate,
Go ahead.
I hate to tell you,
Mhm.
but it ain't over till it's over. I had done a fair amount of, I guess you'd call it prehab, but it wasn't formally. I was a gym rat. I was exercising heavily 6 days a week. And it took longer for my neck muscles and my shoulder muscles to atrophy. But I'm sorry to say, in terms of my mental field radiation, it happened. I remember there was a chiropractor I hadn't seen in a number of years. This is about 12 years ago. And I hadn't seen him for a few years. And I saw him and he said, "What happened to your back?" Like basically all the muscles in my back, which had been very well developed, had collapsed. So I don't know if I could have prevented that inevitability by continuing to exercise, which I didn't, or not. But it seems that the accumulation of these late effects is just sort of a never-ending thing. It's a bit discouraging, to put it mildly.
I'll touch on that because there was another question in the chat that was asking about that. Like if you do stuff sooner after stuff is completed, if it can mitigate it. So it can definitely stall it out. So the more active you are closer to when you've had your treatment, the more you can slow down the process. But unfortunately, it's going to make changes to those tissues with the radiation. So like ultimately you might have some symptoms later on, and those vary widely between people. For probably like 3 years, the majority of what I saw was head and neck cancer. So the region is very much similar to mantle field, and it's a very wide spectrum of what people can present with. But what we did notice is that like earlier you start doing stuff, the longer you can kind of stall some of these later effects from occurring or becoming as severe.
So Michelle, along the same lines, I'm curious, are you seeing differences in your patients who received long ago kinds of radiation like cobalt and newer kinds? I mean, I would assume that the more recent forms of radiation have been less toxic. I don't know if you're seeing that in your practice or.
A little bit. So they're definitely better at protecting areas and conforming the radiation to be very specific to where the tumors are located. So that part has definitely improved. But I also think that certain cancers still just get a lot of radiation.
Yeah.
And like head and neck cancer is one of them. Hodgkin lymphoma is one of them. And it's just, they just give large doses of it. They're trying different things. So like there's been some research, like if they do like larger fractions in a shorter period of time, is it better? Is it better to do smaller fractions and have people get radiation for 6 weeks? So they're definitely trying to figure out what is the best mechanism that gives the least amount of side effects. But I think with how radiation affects tissues in the body, stuff's gonna show up, unfortunately.
So would you also say though that, and I think you did say this earlier, that it's never too late to try to do something? There's no such thing as being a lost cause when it comes to
There's
physical
never,
therapy.
it's never too late. No, we may not be able to get things 100% back where they were, right? But we can almost always make improvements. Me not personally, but another therapist I worked with before would treat people with very severe dropped head. And obviously the chances of getting that all the way back upright are pretty slim, but you can make some meaningful changes for like breathing and ability to eat, and things like that, with therapy.
Joan, I'm going to turn it back to you because I know we have some more questions. Michelle, do you have time to stay on for a few more minutes?
I can stay on for maybe 10 more minutes.
Oh, okay, great. Okay.
Gee, I don't really see any. I see that Michelle answered Bruce's, or Elizabeth's.
I
Anyone
have
have a
one,
question?
Joan, if I can just
Sure.
announce
Yeah.
myself here. Hi, everyone.
Hi, Nancy.
Michelle, thank you so very much. I have a history of radiation for classical Hodgkin's and mastectomy as well as thyroidectomy, and have noticed recently I've been having some difficulty swallowing. I understand for head and neck patients, acupuncture has shown to be effective in promoting better swallowing. I'm wondering if you have any comments on acupuncture as part of rehab therapy.
So I have actually had, not necessarily for swallowing, because that's not my specialty, but I have had patients do really well with acupuncture plus therapy. So like the two together have shown some good results. There's not a ton of research on acupuncture. My thought process for a bunch of people is like, if your risk of infection is relatively low, like you don't mind needles, there's like no reason you can't try it. But I would still recommend maybe seeing like a speech therapist in conjunction with the acupuncture, because there can be, even with the radiation for Hodgkin's, there can still be changes to your swallowing function. And if you've had an additional surgery there, that also changes, like you could have scar tissue in that area as well. So they may be able to give you tips on positions for swallowing, because there's like different things you can do that can make swallowing easier. So I would definitely recommend seeing a speech therapist in addition to trying the acupuncture.
Thank you.
Sure.
Anyone else?
No, and I just saw that there were, someone asked a question about how to find folks in other locations, and Michelle, you put a link on there.
I did.
I think that's something that we run up against so often, is finding people like you and multiplying them so they can be in our area. Whether
That's why I like being on the faculty with ReVital, is because like I teach at least a course every month. And so we probably have 4 or 5 cohorts of different therapists going through a year, learning more about this to try to have more people in the therapy workforce doing this. So like I teach physical therapists and occupational therapists, but our speech therapists are also out there doing the same thing, to improve stuff with speech and swallowing and cognition. So we're really trying. I'll put my email in the chat. I'm happy to try to help people find resources, especially if you're in a ReVital market. I'm happy to try to find a therapist that would be close to you.
I don't know if this is kosher enough, but if you had a physical therapist you working with locally, is it possible for them to have a consultation with someone from so in other words, that you would be able to give a local physical therapist a set of instructions or a set of exercises that are specific to, let's say, a Hodgkin survivor?
So I can help a little bit. Every patient is very different, so that is hard. But if I feel like it's important to share the information. I can't share all the ReVital information because that's specific to my particular company. But I am board certified through the American Physical Therapy Association. So like going there and looking for resources there is a big help as well. Most of the time what I'm working with other providers is more if people are discharging from therapy and like wanting a personal trainer. I always try to meet with the personal trainer and talk with what they feel like is comfortable for people, like what they feel like they're what they're comfortable with me sharing with the trainer to make sure they're safe when they continue to exercise.
Great,
Great.
thank you.
Someone wondered where the PTs get ReVital training.
So the ReVital training is specific for select physical therapy. So there would have to be a select physical therapy employee to get the ReVital training. But the American Physical Therapy Association, their oncology section has continuing education for all therapists. So that would be a better place to look.
Okay. And Gloria wants to know, what general exercise do you recommend?
So in general, I recommend an aerobic activity that you like doing, because if you don't like doing it, you're not going to keep doing it. So if you like walking outside, then walk outside, you know, like if you like biking, like, so find what you like to do aerobically and do that. And then I think that the posture exercises are pretty much the most important for Hodgkin survivors.
Great. Anyone else?
Just one more, Joan, thanks.
Great. Sure. Yeah.
And Michelle, thank you. I'm realizing, you know, many of us were treated years ago, maybe decades ago, and these issues are likely very slow to develop. So what do you suggest in terms of setting a baseline to make sure we can track the development of some of these issues, if they're at all happening?
So I would try to find a therapist that you, like a physical therapist or an occupational therapist that you work well with, because the push for the cancer rehab world is what's called prospective surveillance. So the push is to try to have us be like one of your normal oncology follow-ups, right? Like you see either your oncologist or your primary care regularly. You might see a cardiologist regularly. Like we want to be part of that. So like if you're not having issues, we can see you once a year, right? And check in and take consistent measurements and make sure nothing's changed, right? So that's what the really big push is for us to become more of the survivorship plan as somebody that you see somewhat regularly to catch these things before they really become a problem, to give you the resources to try to mitigate it.
I see. Thank you.
Great. I don't know if this is just something I realized. It's like, I've had really good clinicians, but no one's really offered PT. I always have to ask for it. So I don't know if everyone else has found that, which is pretty shocking, except after breast cancer. So
I don't think it's the standard of care yet in most cancer centers, except for breast cancer.
Yeah.
Unfortunately.
So they're lobbying better than we are. We do have a lot of work to do, Erin.
Well, so I have
That's
a
the one
question.
that I see get referred the most, and even sometimes they still don't get referred.
Well, thank you, Michelle. Thank you, everyone, for coming.
Thanks,
I think
Heidi, too.
I think this
Thanks,
was,
Joan. This was Joan's idea.
well,
We have to give her full credit. And it was great. It obviously got a great response. And we love getting these suggestions from you all. So please keep them coming.
okay.
Thanks, everyone.
Thank you.
Thank you.
See
Thanks for
Heidi.
having me.